Hey everyone, I'm back today with another mock USMLE question. This is going to be question number 14. So the question is, you have a 25-year-old female, past medical history is notable for lupus and orbital cellulitis. She comes to the ED with acute onset pain in the right breast. Patient states that the pain began about 2 days ago and since then has progressively worsened. Patient denies any trauma to the breasts, but states that she recently started breastfeeding 1 month ago after delivery of her newborn. Patient's temperature is 38.4, blood pressure is 116/74, and pulse is 95. On physical examination, the right breast appears grossly erythematous and tender to the touch, but there is no breast discharge present. Which of the following is the most appropriate next step in management? The options are doxycycline, amoxicillin, dicloxacillin, and ciprofloxacin. If you need more time, go ahead and pause the question here. So the correct answer is dicloxacillin. So this question in particular is incredibly high yield for your OB-GYN shelf. So definitely try to remember this question for this. But essentially what this question is asking is, so you have a female who's breastfeeding who comes in with unilateral breast pain. So this is lactational mastitis, which refers to inflammation of the breast, which often occurs in the setting of breastfeeding. And what happens is during breastfeeding, there can often be stasis of milk. And when there's stasis of milk, that essentially becomes a nidus for infection. And often in lactational mastitis, the most common etiology for that infection is Staph aureus, where there's, once again, stasis of milk. Staph aureus is able to go through cracks of the skin where there's a lot of accumulated milk, and it's able to grow and divide there, which eventually causes these symptoms of mastitis, which is this unilateral pain that our patient reports. And the treatment of lactational mastitis is dicloxacillin, because that's one of the antibiotics that's able to target Staph aureus. Once again, this question is incredibly high yield for step examinations and particularly for your OB-GYN shelf examination. One thing I also wanted to briefly mention with regards to this question is, in the question stem, on the first line, I see the patient has a past medical history of lupus and orbital cellulitis. The reason that I included that in there is, on USMLE examinations, on NBME examinations, they'll often put in a lot of additional details which don't have any relevance to actually answering the question. And so this is what I try to do for this question. The point is, try to focus in on what the most important pertinent information is and use that to answer the question. Don't get weighed down or too worried about a lot of additional details which may not play a role. So once again, unilateral pain, tenderness, erythema, on a female who's breastfeeding, it's lactational mastitis, which is most often secondary to Staph aureus, and treatment is dicloxacillin. That's going to be it for today.